Good morning, everyone, and I'd like to begin by acknowledging that we're on the traditional territory of the Musqueam, Tsleil-Waututh, and Squamish peoples. It's wonderful to be here with you today, with all of you here today virtually, to enjoy this exciting announcement about improving mental health and substance use for young people in our province. Here in British Columbia, as we know, we are facing two public health emergencies: the COVID-19 pandemic and the ongoing fentanyl poisoning crisis. And I have heard from so many British Columbians, including youth and young people, that the COVID-19 pandemic is having a really major impact on their mental health. Finding a summer job, going to school at home, being away from your friends, not being able to take part in social and sports activities, all of these things are having a significant toll on your mental health and well-being. And many of the things that normally bring us joy, like spending time with family and friends, like taking part in parties and birthdays, have been delayed, and sometimes for a very long time. Many youth are in need of support more than ever before. And today I'm here to tell you that there is hope, that greater support for young people is coming to your community, to 8 new communities across BC. During this challenging time, we do have something to celebrate. And that brings me to why we're here today. I am thrilled to announce that 8 more locations are going to join the Foundry network for a total of 19 Foundries across BC. Yes, that's right, 19 Foundry Youth Centres across BC. And I want to offer a warm and enthusiastic welcome to Langley, Port Hardy, Squamish, Comox Valley, Williams Lake, Burns Lake, Cranbrook, and Surrey. You will be joining a vibrant network of foundries already established in Campbell River, Victoria, Kelowna, the North Shore, Prince George, Vancouver, Abbotsford, Penticton, and Maple Ridge. What a long list, as well as Richmond and Terrace that are coming soon. And I am overjoyed that urban and rural and Indigenous youth will now be served in so many regions across our province. Foundry supports thousands of youth aged 12 to 24 by providing the healthcare, the mental health and substance use services they need and deserve in an environment that is welcoming, that is supportive, and that is non-judgmental, where youth can get the help they need when they need it. And most importantly, this is a big win for youth and families who will be able to access these services in their own communities, close to home and close to family and friends. I know an enormous amount of work has been done to get us to this moment, and it is a monumental moment indeed. There are so many people who've played a vital role in getting us to this place, in making Foundry the successful model that it is today. 3 of those inspiring people are here today to celebrate this wonderful announcement: Saren Frisky, Jessica Sewell, and Dr. Steve Mathias. And I really want to acknowledge the way that Foundry has stepped up big time to support young people during COVID-19. You know, it was on April 7th, literally 3 weeks after the pandemic was declared, that Premier and I announced $5 million in funding for mental health virtual supports. And Foundry has been an absolutely critical partner in standing up those virtual health supports for youth quickly. Foundry is now providing virtual services, including vital drop-in counseling and peer support sessions by phone, by video, and by online chat. And those services will be expanded even further to include primary care as soon as possible. And as more restrictions are lifted in the coming weeks and months, as we move slowly towards a new normal, I know that the 8 new Foundry centers that we're announcing today will be absolutely vital. Because at Foundry, no matter which center you visit, whether you visit in person or virtually, youth and their families get a sense of community. They get a sense of belonging. They can access services from qualified professionals, and very importantly, they can get the support they need directly from their peers. When young people walk through the doors of Foundry, they know they're at the right place, period. You can feel it. It's in the air, it's in the surroundings, it's in the way every person is treated with dignity and respect, and without judgment. Last year, Premier John Horgan and I announced a pathway to hope, our roadmap to improve mental health and substance use supports for all British Columbians. And I can tell you, when it comes to child and youth mental health, we are moving full steam ahead. Congratulations again to the entire Foundry family. Today is a testament to your hard work, your dedication, and your drive to help young people not just survive, but thrive. I look forward in the months and years to come to hearing the inspiring and uplifting stories of the many youth that will have been helped thanks to these 8 new Foundry centres. It is so wonderful to be here with folks from Foundry for this important announcement today. We are now going to show a short video about the difference that Foundry is already making in the lives of youth across British Columbia, and then I will be inviting Dr. Steve Mathias, the Executive Director and inspiration behind Foundry BC, to come up and say a few words.
On behalf of the Langleys
and Encompass Support Services Society,
we are excited
to welcome Foundry to Langley. We just can't wait.
Welcome, Foundry.
Welcome, Foundry.
Keys to the Union, Foundry.
Welcome, Newcastle, Foundry.
Welcome, Foundry.
Surrey welcomes the Foundry.
Welcome, Foundry. The Caribou's Home Child Development Center and the community have been patiently waiting for you.
Welcome!
Please state your name, followed by the pound. Joining.
Thank you, Mr. Darcy. I want to acknowledge, first of all, on behalf of Foundry, the incredible work done by our leaders in government and public health through the recent COVID pandemic, particularly Premier Horgan, Ministers Dix and Darcy, and of course our colleague, Dr. Bonnie Henry. We're grateful for the thoughtfulness and measured approaches during a unique time in our history, one that will forever be marked by the pause it forced us all to take, to reflect on the people who were dear to us, the activities that kept us vital, and the liberties that we may have taken for granted. I also want to thank and acknowledge the work done by my colleagues, brothers and sisters in healthcare and essential services, particularly those service providers at our Foundry centres who adapted, shifted, and adopted while keeping their doors open, either at their storefront or virtually, and for their compassionate care provided to the young people and families we serve. I want to highlight that in British Columbia, while we have been struck by both a pandemic and a toxic fentanyl epidemic, we cannot forget that for over 20 years we've been concerned in BC and in Canada about the mental wellness and well-being of our young people. So much so that in 2014, a provincial select standing committee on child and youth mental health was struck to examine this issue. And in that nonpartisan report, it was noted that child and youth mental health services suffered from long-standing institutional fragmentation, that young people, particularly those in their teens and early 20s, were falling through the cracks and struggling to find help for mental health or substance use concerns. In these past months, with all our Zoom meetings and social isolation, it's easy to forget that well over 140,000 young people in our province every year suffer from mental health or substance use concerns. In 2020, the year of COVID, quarantine, school dismissals, sport and recreation cancellation, employment layoffs have done nothing to improve the lives of thousands of parents struggling to help their children, their teenagers, and their young adults before they lose all sense of hope. Further, it isn't inconceivable that we will recognize this generation of young people as the group that sacrificed the most to flatten the COVID curve. The issue of mental health, wellness, and well-being, one that has remained unaddressed in most of our country, requires investment, systemic change, and institutional reform. Thanks to the leadership of our government and minister, and through the Pathway to Hope plan mentioned just minutes ago by Minister Darcy, Foundry, established in 2016 as a whole province initiative, is intended to support the changes needed to ensure that young people and their families know where to go or who to contact when they have a question, a challenge, or just need to talk to someone. Currently, 9 Foundry centers are open, with 2 more in Terrace and Richmond opening this summer. Located in these centers are groups of wonderful people from a multitude of community organizations who come together to work as one team under the growing network and increasingly familiar name, Foundry, as in, I found what I'm looking for. I am so pleased and humbled to announce today that our Foundry family is expanding to include 8 incredible nonprofit organizations, their partners, 8 more communities where young people, families, and care providers will be engaged, empowered to voice their opinions and thoughts, and to lead the transformation in their community. The Foundry Network welcomes Carrier Sekani Family Services, their partners, and the youth and families of Burns Lake. North Island Crisis and Counseling Center, their partners, and the youth and families of Port Hardy, Mount Waddington. John Howard Society of North Island, their partners, and the youth and families of Comox Valley. Pacific Community Resources Society, their partners, and the youth and families of Surrey. And Compass Community Services Society, their partners, and the youth and families of Langley Township and City. Sea to Sky Community Services Society, partners, and the youth and families of Squamish and the Corridor. Caribou Chilcotin Child Development Center Association, their partners, and the youth and families of Williams Lake. Tanaxa Tinbasket Child and Family Services Society, their partners, and the youth and families of Kimberley Cranbrook. Over the next month, these organizations and communities will don their hard hats as they support the growth of their local network of services and create spaces purpose-built for their young people and families. And in the end, each of these centers will offer counseling, mental health and substance use services, peer support, physical health resources, and social services, easily accessible, giving hope to youth and families. Now, as I mentioned earlier, meaningfully engaging young people and their families is a critical ingredient in the Foundry special sauce. And so to talk more about this is the amazing Seren Frisky, our Provincial Youth Engagement Coordinator. Seren?
Thank you. Good morning. My name is Seren Frisky, and I would like to start off by acknowledging with gratitude that our work takes place on the unceded land steeped in rich Indigenous history and home to many First Nations, Métis, and Inuit people today. We recognize and respect Indigenous people as traditional stewards of this land and the enduring relationship that exists between Indigenous peoples and their traditional territories. As a youth engagement coordinator at Foundry, I have the privilege to work directly with young people across BC who will one day be, and who are currently, leaders in their communities. I have been able to witness the incredible projects, causes, and passions of these young people and support them along the way. These young leaders are members of the Organizational Governance Youth Advisory Council, or OGYAC for short. The purpose of this council is to further support youth input and involvement, and the OGYAC aims to strengthen youth in leadership, working directly with Foundry's central office. OGYAC members have the opportunity to co-lead council operations and co-create a youth advisory council targeted to their specific needs. This provides space for members to identify any training or development opportunities of interest, as well as collaborate with other youth representatives from Foundry centers across the province. Last summer, Foundry Central consulted with the OGYAC and provincial family ambassadors to ask them what would be important for us to consider about expansion. Their advice helped to shape our overall process. Then the OGYAC and PFA were involved throughout expansion, from creating questions for the written applications to participating in the interviews. Last fall, we had an evaluation panel made up entirely of youth and families reviewing the expressions of interest. And in March, our OGYAC and PFA helped to facilitate the in-person convening session. As you can tell, we truly care about youth engagement, and it defines every single aspect of our work. At Foundry, principles of youth engagement are core building blocks, from research to services to program development and even the colors featured in a Foundry Center. It's all youth and family informed, and we are grateful for the members of OGYAC and PFA for their invaluable insight and expertise on the expansion of Foundry Centers. The future of our organizational governance Youth Advisory Council will be committed to reflecting the population of BC, ensuring each of us has representation and opportunities to be seen and heard. The new communities where each center is situated will share in strength, resilience, and knowledge to make sure Foundry is a place where youth can gather and find the services that they need. We should seek to harness the innovative spirit of young people in addressing our development challenges. And this is a commitment at Foundry. Youth hold the power to shape the dynamics of the world. And if we want change, we must provide leadership support for youth in making change possible. At Foundry, we also recognize and are prepared to put in the work to ensure we are a place where all youth of any background can access services and find support. We are committed to creating the space for Indigenous peoples to lead the way to self-determination, healing, and wellness while working in partnership with Indigenous communities and nations to embed Indigenous wellness models into our practice. I want to ensure that all Indigenous peoples have access to culturally safe, comprehensive, and supported models of healthcare and wellness that affirms, facilitates, and restores the well-being of our people, and which contributes to reconciliation and culture building. This is no small undertaking, and we understand its incredible importance, and we want to listen to Indigenous youth across BC. But enough from me. I now have the absolute pleasure to introduce one of our Foundry OGAC members, Jessica Sewell. Jessica has been connected with Foundry for 3 years and has been involved with both her local Youth Action Committee in Victoria and the Provincial Youth Advisory Council. Her main focus has been in educating youth about the opioid crisis through her harm reduction-based organization. She believes in accessibility, respect, and the power of a conversation. Jessica has been part of the convening and expansion process in choosing the 8 new center locations and is so excited to see them go forward and help more youth. Welcome, Jessica.
Thank you. We all know someone who has struggled in some way with mental health, physical health, or addictions. But we also know that they're more than just a patient searching for a service that works for them. They're a human being, a youth, who deserves respect and care. They're filled with hope, something that Foundry has given to thousands of youth across the province. I became connected with Foundry through a family friend whose daughter took her life. Her wish was that the conversation around mental health would happen out in the open and not behind closed doors as has previously been. For the past 3 years that I've been involved with the network, I've been continuously inspired by the incredible human beings who make the community what it is. Foundry expansion is an opportunity to expand the impact to thousands more youth. And the number of folks that showed up to represent their communities at Foundry convening, all with the goal of making youth healthcare better in this province, was truly an incredible thing. This goes to show that the barriers to care in the form of stigma are slowly coming down so that more youth can access services. Over the past number of years, Foundry has led the movement towards a better, healthier BC by chipping away at the shame and blame that has controlled the conversation around mental health and addictions for so long. Being involved in the expansion process as a youth was extremely empowering. Myself, along with the other youth, were at the table 100% throughout the process. The network allowed us to have a voice in our own health, something that is truly incredible. I was speaking to a friend the other day and sharing how lucky I am to be working with an organization that appreciates my voice and expertise at such a young age. What's really great is that this engagement happens both at the local and the provincial level. So we have an amazing diversity of experiences. I'm a volunteer, but I also feel like I'm working my dream job. The fact that youth voices are heard and ideas implemented only makes the network better. And I think that a lot of healthcare organizations can learn from the way that Foundry engages with youth and their families. To finish, I'd like to share what a friend told me when I asked him about what having a Foundry Center in his community means to him. He shared that it was a safe place for him and his emotions, somewhere where he knew that he'd never be judged. This speaks to how the province-wide network has given so many people hope. It's given youth and their families somewhere to go when they have nowhere else to turn. It's given them a place to call home away from home. And I'm so excited to watch the network grow over the next few years, changing and saving lives as it expands. Thank you.
Thank you. I would now like to invite Mr. Darcy back to the podium for the Q&A. And before we begin the Q&A segment of this event, I would like to remind the media that you're limited to 1 question, and please do press *1 to line up for questions. If we have time, we will be able to take your follow-up questions. You will have to line up again by pressing *1, and please keep your handsets unmuted. You will not be heard till I call out your name. I will begin by Lisa Cordasco from CHLY. Lisa, go ahead, please.
Hello, good morning. I'm wondering why Nanaimo has been passed over in all of this. There are no treatments locally. There are no homeless shelters locally. Nothing is in person. The closest resource, I guess, would be Victoria. Wondering why Nanaimo's been left out here.
Well, there is actually an independent process in place led by Foundry to determine the sites, and they put out a call for proposals, and communities submit proposals, and these 8 locations were chosen after a very extensive 2-step selection process, which included independent panels made up of over 60 members of Foundry's network of centers. They were subject matter experts, they were youth, and they were family advisors.
Thank you. The next question is from Jane Said, Not Sure News. Go ahead, please.
Yeah, I have heard from some families that access Foundry that the online support model may not really be working for all teams. I understand that as of right now, that's the way that, for instance, families on the North Shore are supposed to be accessing these services. I'm just wondering, you know, teens can go get their nails done and their hair cut in person. Why can't they get, you know, peer support or drop-in support in person in Foundry, and when is that expected to change?
Thank you for that question. In terms of Foundry North Shore and most of our centers, existing clients or young people can get services in person. If this is someone who's new to the Foundry North Shore Center and virtual care is not working for them, then they can call the front desk, let them know that virtual care is not their preferred option, and a in-person session can be booked.
And since there are no other questions from the media, I would like to conclude this event. Thank you all for attending and joining us today.